Hi everyone. So in this video we will be discussing third part of the surgery images section. The first image shown is of upper GI bleeding and the tubes used in that. The first one is Linton tube. Linton tube has only one balloon and that is gastric balloon. And the port is used, the gastric suction port and balloon inflation port that are present. And in the Sengstaken tube, the three ports are present. What are that ports? The gastric suction port, the gastric inflation port, and the esophageal balloon inflation port. Two inflation and one suction port. And this is the esophageal balloon and the gastric balloon. Two balloons are present. While in Minnesota, two aspiration port or suction port and two inflating ports and the two balloons are present. Here was one suction port for gastric part. Here gastric as well as esophageal suction port is present. So that is about the tubes used in the upper GI bleeding. Then next image is of deulophile lesion. Deulophile lesion is a submucosal artery and the treatment for it is endoscopic, cautery or coagulation. The submucosal artery causing a bleed in the stomach. Then next image we have is of GAVE, gastric antral vascular ectasia, and it gives classical appearance that is watermelon stomach. Watermelon stomach is basically the stripes, like stripes are there in the watermelon. Similar stripes are visible on endoscopy of the stomach. Then next we have the European Hernia Society classification. In the European Hernia Society classification, the hernial defects are named according to the situation in which they are lying, according to the location. In the midline they are given M and in the lateral region they are given L. In the midline, M1 is subxiphoid, M2 is epigastric, M3 is umbilical, M4 is infraumbilical and M5 is suprapubic and L1 subcostal, then L2 is flank, L3 is iliac, and L4 is lumbar, and one defect is equivalent to 1.5 centimeter. Then next we have the image of myopectineal orifice. Myopectineal orifice is the orifice in which all the three hernia, that is direct, indirect inguinal hernia, and femoral hernia can occur. The superior medial boundary is formed by rectus abdominis, superior medial and the inferior-medial boundary is formed by pectineus, rectus abdominis, then pectineus, then inferior-lateral boundary is formed by ilios vas, and the superior-lateral boundary is formed by conjoint tendon. Rectus abdominis, then pectineus, then we have ilios vas, and then we have conjoint tendon. Then next image we have is of Halsted sutures and Cushing and Cornell sutures and Lambert suture. Basically what we need to remember is what all are single layer anastomosis and what are double layer anastomosis. In the single layer we have Lambert sutures. Lambert suture are seromuscular, that is including the serosa and the muscle layer as shown in this picture, and then the Cornell suture includes all the layers, and the Halsted sutures are extramucosal. Halsted does not include the mucosa, and Matheson is also extramucosal. Lambert, Cornell, Halsted, and Matheson all are single layer anastomosis. While in double layer we have Cockers and Sands. Just remember the names, no need of remembering this much detail. Just remember which are single layer and which are double layer. Then next image we have is of different angles used in the laparoscopic surgeries. The azimuth angle. The azimuth angle is the angle between the scope and the instrument and it is 30 degree. Then we have the elevation angle. Elevation angle is the angle between the horizontal axis or ground and the instrument, that is equal to 60 degree, and the manipulation angle is angle between the two instruments and that is also 60 degree. So both the elevation and manipulation, that is 60 degree, and the azimuth, as the A is the smallest letter, so it is the smallest angle and it is 30 degree. Then we have different positions which are used in surgery. This is the prone position, then person lying flat, on over her back is supine position and bended towards the left side. Here the person is bended towards the the side which is facing downwards. That is that recumbent position. So right lateral. Here the person is lying on her left side. So that is left lateral recumbent. Then we have Fowler's position, sitting position, and then we have Trendelenburg position. Trendelenburg means head down position. And if the head is up, then we have the reverse Trendelenburg position. Then next we have the image of tumors with the presence of central stellate scar. Central stellate scar is a classical finding in renal oncocytoma, in the serous cystadenoma of pancreas, and in the focal nodular hyperplasia of liver. Renal, pancreatic, and liver. Oncocytoma, cystadenoma, and focal nodular hyperplasia. Then next image we have is of incisions used in different surgeries. The first one we studied is Cocker incision. Cocker incision is used in open cholecystectomy. It will be present on the right side. Then if it is on the left side, then it is called chevron incision, and it is used in Whipple's disease, Whipple's operation. That is in the case of pancreatic head carcinoma. Then we have the paramedian incision, then the midline incision, and then the transverse incision. And the variation of paramedian is McCavity incision. Then we have gridiron and lance incision. Gridiron and lance incision are basically used in appendectomy, and it is muscle splitting incision, while the Rutherford Morrison is a muscle cutting incision. Then Pfeffenstiel incision, this is used in cesarean section, and the variation is Maillard incision. Then we have the incision for paroidectomy that are not given in this diagram. So lazy S, cis trunk, and modified Blair's. These are the three incisions which are used in paroidectomy. Lazy S, cis trunk, and modified Blair. And Turner Warwick. Turner Warwick is used in retropubic space. So what all we have? Cockers, chevrons, Mercedes-Benz incision, paramedian, midline, McCavity, Millard, Caesarean, Pfeffenstiel, Rutherford Morrison muscle cutting, Lance and gridiron muscle splitting. The next image we have is of myocutaneous flap. Here the myocutaneous flap is being used, and the most common is pectoralis major flap. The next image we have is of Matthews and High classification of muscular flaps. Basically, the flaps are of many types, uh, that are of five types, and we will be studying each type and example of this. The type 1 is which is having one vascular pedicle. Example, gastrocnemius and tensor fascia lata. Then type 2 is one dominant vascular pedicle and minor vascular pedicle. Means one pedicle will be dominant and the will be minor. That is seen in gracilis and soleus. Gastrocnemius is a large muscle of the leg, so remember that it has only large one large vascular pedicle, and gracilis and soleus have two vascular pedicle, means many more than one vascular pedicles. Then type 3 is two dominant pedicles. Up to 1 and 2 we were having only one dominant pedicle, while here we have two dominant pedicles, and these are present in gluteus maximus, and then we have the pectoralis minor, rectus abdominis, and serratus anterior. Remember by RASA. And pectoralis minor and gluteus maximus. Then we have type 4. Type 4 are segmental pedicles. Segmental pedicles is for sartorius, tibialis anterior, and external oblique. In the external oblique, in the segmental, SE comes. SE stands for sartorius and E stands for external oblique. Then type 5 is dominant vascular pedicle and secondary pedicles. That is internal oblique and latissimus dorsi and pectoralis major. So type 1, we have one vascular pedicle, gastrocnemius and tensor fascial lata. Type 2 is one dominant and other short vascular pedicle, soleus and gracilis. Then we have two vascular pedicles. Two vascular pedicles are found in RA, rectus abdominis, serratus anterior, gluteus maximus. Type 4, many segmental. Segmental S for sartorius and EO for external oblique. Type 5 is dominant and segmental. That is all, and it is found in PMLD, pectoralis major and latissimus dorsi. Then, what are the vascular pedicle commonly used in breast? That is RA and LD. One from the type 3 and one from the type 5. From the type 3 we have RA and from the type 5 we have LD. That is rectus abdominis and latissimus dorsi. Then we have head and neck. In the head and neck reconstruction, pectoralis major from the type 3, pectoralis from the type pectoralis major from the type 5, and SA serratus anterior from the type 3 is used. PMSA for head and neck and RALD for breast. Then next we have the image of Adson's test. Adson test. Basically, we will be discussing all the tests which are used in thoracic outlet obstruction, and these are the provocative tests. So Adson test, the patient will be sitting like this position as shown in the image. The the arm is extended at elbow and externally rotated, and the shoulder is slightly abducted. And patient is asked to take a deep breath while extending the head and turning the head towards the ipsilateral. So he is looking towards his arm, and the severely decreased or absent radial pulse